Do you know why insulin prices in America have jumped over 600% in the last 2 decades? If you or someone you love depends on this medication, you've probably felt this devastating financial toll. In this video, we'll break down why insulin costs so much, who's profiting, and the potential solutions that could save lives. First, let's start with the numbers. The price of insulin in the US has increased over 600% in the last 2 decades. For reference, in 1999, a vial of insulin cost about $21. By 2019, that same vial could cost upwards of $275. For many people with diabetes, a month's supply costs as much as $1,000 or more. But why the steep price? To understand this, we need to look at the key players in the insulin supply chain: pharmaceutical companies, pharmacy benefit managers, and insurance providers. Here's how it works. Pharmaceutical companies manufacture the insulin. Then pharmacy benefit managers, or PBMs, act as middlemen between drug makers and pharmacies, negotiating prices and rebates. Finally, insurance companies determine how much of the cost gets passed on to you, the consumer. Sounds simple, right? But here's the catch. The process is anything but transparent. PBMs often negotiate higher prices to secure larger rebates from manufacturers, and those rebates rarely trickle down to the patients. Instead, they keep the profits to the insurers and middlemen. The result? People with diabetes are forced to make impossible choices. According to a Yale study, 1 in 4 Americans with diabetes has started rationing their insulin because they couldn't afford it. And the consequences are dire. Rationing can lead to serious complications like kidney failure, amputation, and even death. So what's being done about it? In recent years, lawmakers and advocacy groups have started pushing for a change. Some states have implemented insulin price caps, limiting out-of-pocket costs to $35 a month. Additionally, pharmaceutical companies like Eli Lilly have introduced their own discount programs, but these efforts only scratch the surface. The bigger issue lies in the lack of competition. Did you know that just 3 companies, Eli Lilly, Novo Nordisk, and Sanofi, control over 90% of the global insulin market? This lack of competition allows them to set prices with little accountability. And it gets worse. Insulin is still protected by a web of patents that block generic versions from entering the market. These companies file dozens of evergreening patents on slight tweaks to their formulas, extending their monopolies and keeping prices high. The good news is that there's growing momentum to challenge these practices. In 2021, the House of Representatives passed a bill to cap insulin prices nationwide, though it's still awaiting Senate approval. Meanwhile, organizations like T1 International and Patients for Affordable Drugs are fighting tirelessly for reform. But the question remains, will it be enough? Here's the bottom line. Insulin is a life-saving medication, not a luxury. The current system leaves millions of people vulnerable, and the stakes couldn't be higher. But change is possible if we continue to raise awareness and demand accountability from pharmaceutical companies and lawmakers. So what do you think? And don't forget to subscribe for more deep dives into the hidden costs of healthcare. Until next time, stay healthy and avoid those medical bills.